France is just hours away from a nationwide lockdown. President Emmanuel Macron says the country is facing a public health war and that it will take an all-out mobilization to slow the spread of coronavirus. COVID-19 has killed 148 people in France and infected more than 6,600. All citizens will be required to stay home from midday. The restrictions will stay in place for at least 15 days.
On the front line, the caregivers at Lille University Hospital. When patients arrive with lung problems, they are taken to a special unit. But it's also important to keep the medical staff healthy. The priority is really to protect ourselves. We use protective clothing where we are with the patients. The Emergency Response Center in the city has seen 5 times as many calls as usual. The technology failed to keep up the pace. The computer system broke down.
The computers didn't stop for long because the engineers arrived immediately. Why? Simply because there were so many files that the hard drives ran out of memory. We never imagined that we could get there in such a short time.
In southern Alsace, one of the areas hardest hit by the virus, health authorities have already reached breaking point. There are almost no more intensive care beds. In his address to the nation, Emmanuel Macron announced that a military hospital will be set up in the region and the army deployed to transport the sick to hospitals.
We are at a war. We're in a public health war. We're not fighting against an army or another nation, but the enemy is here, invisible, elusive, an advancing enemy, and that requires general mobilization.
Hours before Macron commanded the French to stay home, people rushed to stock up on supplies. Starting from midday today, the movement of citizens will be tightly restricted. People will be allowed to leave only for essential activities like food shopping. Some 100,000 police will be deployed to enforce the lockdown.
Violation of these rules is currently punishable by a fine of around €38. It will be raised very quickly to a higher level, which could be €135. Our aim is not to punish, but to call everyone to account.
As doctors warn about an increasingly dire situation, many hope the aggressive move by France will save lives.
Our correspondent Lisa Lewis joins us now from Paris. Lisa, France faces a complete lockdown starting midday today. What's the situation in Paris where you are right now? How are people responding to the crisis?
Well, I think many people here were expecting that there were rumors going around that it would even be worse, actually, that we have to stay at home for 45 days, couldn't leave the house at all, and that there would be a complete curfew from 6 p.m. on. Now, what the president announced was a bit of a lighter version of that. However, many people are obviously not really happy about that. There are lots of people, it's reported that many people are actually leaving big cities such as Paris to go to the countryside and stay with someone for this period of 2 weeks. Some people, though, are expecting the president, the government, to maybe announce even stricter measures, thinking that this might be just the first step.
We see here live pictures as you speak, Lisa, of the Champs-Élysées. Still a lot of traffic, maybe people driving into the country or maybe not taking it seriously enough just yet. Yet experts warn of an increasingly dire situation. What does that mean for each and every one?
Well, it means that now from midday on, really, you will not be able to leave the house unless you go grocery shopping. You have to go to work. That is, you can't actually work from home. You have to take care of someone, for example, an elderly parent. And this all works with a declaration of honor that you have to download from the internet. You say, you know, I declare that I have to go to the shops now, and then you will be let through. You can also go for a run, for example, or walk your dog, and unless you go with someone. So the government is really trying to isolate people. I think now people are still trying to do the last thing that they needed to do before going into lockdown. That's why there are many people out in the streets, or many people are also leaving certain places to go to the place of confinement for the next 2 days.
Now, some in France say that we could soon see a scenario like in Italy, where doctors have to choose who to treat, a decision between life and death. How fast is the outbreak progressing in France?
It's progressing faster and faster. We're not at the Italian scenario just yet, but the number of contaminated people over the past 24 hours was at 1,200 compared to 800 the day before. So it's progressing faster, and that's also what the government wants to make clear to people, that if they want to prevent that Italian scenario from happening, that they have to stay at home. The president last night in his speech said several times, we are at war. He was appealing to the civil responsibility of each French person, each people living in the country, because obviously he had the impression that people weren't taking this seriously enough, especially as many people on Sunday afternoon, it was really nice and sunny here, were out in the streets, spending time with their friends close together, not respecting the minimum distance. And he really wanted to make clear that the French now have to change behavior if they want to prevent the Italian scenario from happening.
All right, Lisa Lewis, they're reporting from Paris. Thank you so much. Well, here in Germany, the government is also ratcheting up its response to the coronavirus outbreak. More than 7,000 Germans have been diagnosed with COVID-19. 17 have died. Chancellor Angela Merkel addressed the nation on Monday. Her message: no more travel, stay at home, keep your distance.
The chairs had been especially arranged to keep people well apart. But that wasn't the only thing out of the ordinary at this press conference. After high-level talks at the Chancellery, Merkel stepped out to announce the most drastic response to a health crisis in living memory. Retailers of essential supplies, such as pharmacies, will remain open. Supermarkets will even be open for an extra day on Sundays. But from playgrounds to hotels, leisure activities have been severely curtailed.
Hotel accommodation can only be rented for and non-tourist purposes. That also means that there will be no holiday travel within Germany and abroad.
Bundestag President Wolfgang Schäuble met with party leaders to discuss how to keep parliamentary business running during the pandemic. Later in the day, Merkel held a telephone conference with state ministers over the new measures. Restrictions such as the closure of playgrounds are to be implemented uniformly across the entire country. In Germany, hospitals are well stocked, and the government is keen to allay fears over the fallout from the disease.
We are setting aside 10 billion euros to meet the costs arising from additional medical expenditure and the economic consequences of the virus. We are leaving no one behind.
A crisis committee set up by the Health and the Interior Ministries is meeting on Tuesday to help put in place the raft of restrictions. The question now is if the measures will succeed in slowing the spread of the coronavirus.
And for more on the situation here, let's bring in our political correspondent, Hans Brandt. Hans, new measures are practically announced on a daily basis now, but no complete lockdown as in Italy or France just yet. Why is Germany taking a less drastic approach than some of its neighbours?
I think there are two reasons for this. One is a formal reason. The fact is that the central government in Germany has not yet declared a state of emergency. In other words, it has not yet got the powers formally to impose such a lockdown. The other reason is I think that that final coercion is the final instrument that the government still wants to keep as a possible next step, while at the same time trying to in some sense, still force people not to go out simply by making the reasons to go out all the more difficult, to reduce the number of reasons why people would like to go out. There's no reason anymore to go to the cinema because it's closed, to go to the theatre because it's closed, to go to your gym because it's closed. So people have no reason to leave their homes, and at the same time, this form of how shall I call it, maybe lockdown by persuasion is still an attempt to appeal to people's reasoning, to tell people, look, we are not going to force you to do this, but please, now, under these circumstances, you really must understand that it's necessary.
Especially as the number of cases keeps rising. How are Germany's hospitals and the health system as a whole coping right now?
At the moment, Germany has not yet reached the position where the number of serious cases that need hospitalization, that need intensive care, that need respiratory help, that number of cases is not so large yet that the German hospital system is under strain. The final wave that could overwhelm the hospitals has not yet arrived there, and that, in fact, is the reason for these new measures, and in fact the reason for all the measures that have been taken in recent weeks. It's to try and avoid that from happening, to try and prevent the large number of cases in fact coming into existence for such a large number of people to be infected so seriously that the hospital system breaks down. The hope is that the number of infections, the number of new infections will be reduced enough so that the hospital system in the end can cope with those people that need that critical care.
All right, our political correspondent Hans Brandt, thank you so much. British Prime Minister Boris Johnson has urged all citizens to refrain from non-essential contact with one another to help slow the spread of coronavirus. He called on Britons to avoid all social venues as the country faces what he referred to as the fastest growth period of the virus so far. His government is still facing criticism for not ordering school closures. But Johnson said that social distancing measures will help to ensure the virus is a short-term problem.
Now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel. We need people to start working from home where they possibly can, and you should avoid pubs, clubs, theatres and other such social venues. We are asking people to do something that is difficult and disruptive of their lives, and the right moment, as we've always said, is to do it when it is most effective, when we think it can make the biggest